Okay, so our topic is reversing diabetes risk, and I'd like to be able to present some easy, effective strategies. Easy, I'll probably put in quotations um, because things are all relative. So in order to uh, understand diabetes, we need to understand a little bit the role of blood sugar and insulin, define diabetes in terms of type 1 and type 2, understand the concepts of prediabetes and insulin resistance, as well as metabolic syndrome. There's some things to learn about nutrition and nutrient timing, the role of movement in combating prediabetes and diabetes, as well as the impact of sleep and stress. So what is blood sugar and blood glucose? So blood sugar, or blood glucose, it's the main sugar found in our blood, and it's our main source of energy. And basically all carbohydrates, fats, and proteins eventually break down to glucose. So it comes from the food that we eat. We can also create glucose in our bodies. Our liver does that. So in order to be utilized, it needs to get into our cells so that we can convert glucose to energy. And then we'll review in a couple different ways, kind of an average fasting glucose is 80 to 90, an average 2 hours after a meal, or what we call postprandial, is 120 to 140. And our liver acts as the main buffer of our glucose. So our liver is really important here, and we'll talk about that a bit more. So what is insulin? Insulin is it's a peptide hormone. It's actually what we call a propeptide because it is a combination of insulin and C-peptide when it is produced and released by the beta cells in our pancreas. And so the pancreas is that organ that's kind of right across the middle of our upper abdomen, beneath our stomach. Insulin that is released from the pancreas drives glucose into our muscles and liver, as well as increases fatty acid uptake in our fat cells. So it kind of makes fat cells more fat. So just based on that, you can tell like you probably don't want a lot of insulin. So insulin's actually not needed to get glucose into the liver. It is really important for getting glucose into our muscles. And that actually can be impaired if we have more fat in our liver and our muscles. So that will be a key that we'll talk about a little bit more. But really, we need insulin. It functions for us in very necessary role, but we're getting into a time period, in the world, as more people have gained weight and potentially become less active, and we have really calorie dense and nutrient poor foods, so that has become more of a problem. So diabetes, type 1 diabetes is generally, we think about people getting this when they are young. It's 90% of the time it's an autoimmune process. And what happens is those beta cells in the pancreas actually get destroyed. And so you're unable to produce insulin. This can happen in an adult as well, but it's far more common in a child. Type 2 diabetes, we used to call this adult onset diabetes. And unfortunately, it's becoming even more, more prevalent in our society, even with younger folks too. So that, unfortunately, we don't really refer to as adult onset anymore, but we do call it is non-insulin dependent. And type 1 you could call insulin dependent. So, but back to type 2, our beta cells eventually can poop out and become less able to produce insulin. Probably, really the main underlying thing is our cells become less insulin sensitive, so they become more resistant to the insulin. And so in order to get glucose into your muscles, you'd need over time more and more insulin, which is, clearly an issue, and that can cause that burnout. So criteria for diagnosis of diabetes, that'd be a fasting plasma glucose higher than 126, a random glucose greater than 200, a hemoglobin A1C of greater than 6.5%, or a 2-hour oral glucose test, which is done pretty commonly in diabetes or in pregnancy to screen if that comes back greater than 200 as well. So basically then you're ingesting this sugary drink, and then we test your blood sugar. We can also test insulin at hour intervals to see what happens with your insulin, what happens with your glucose. So pre-diabetes, thinking about what causes this, like certainly, like if we think about poor lifestyle, what does that mean? Probably inactive, high stress, poor sleep, those things can cause insulin resistance. Toxins and environmental burden, that really refers to toxins a lot of times in our foods, in food production, and it can be other environmental toxins. And it doesn't have to be a one high dose sort of toxin, but it can be multiple toxins over time. Mitochondrial dysfunction, and mitochondria are the powerhouses of our cells. And if they start to function more poorly, that basically means we're not creating energy as well. And creating energy is an energy demanding process. So that can be a problem. The other thing that has, I wouldn't say it's entirely new, but it's newer, is microbiome imbalances. And so really, like, your gut flora plays a big role in your response to different foods and nutrients. So that's really kind of becoming a bigger area. Altered body composition, certainly if somebody is heavier, that is problematic. If we start to carry more fat kind of in our central abdominal area, abdominal obesity, that is problematic as well. And there is definitely some genetic predisposition as well. There's a term that I want people familiar with, and it's called metabolic syndrome. And what it really comes down to is looking at, we'll really go through kind of what we call these NSEP, ATP3, this 2005 revision guidelines. So you have metabolic syndrome if you have any 3 of the 5 criteria. So if you're a man, waist circumference of greater than 40 inches, a female, waist circumference greater than 35 inches. Fasting glucose greater than 100 milligrams per deciliter, triglycerides greater than 150. HDL cholesterol, for a man, we want it above 40, and for a female, it needs to be above 50, or that is a risk factor. And the cutoff that is used in the NSEP guideline is 130/85 for blood pressure. So the goal clearly would be to have none of these. 90% of Americans have at least one. And if you get into where you have 3 or more, you really are at increased risk of like metabolic disease, cancer, cardiovascular disease, Alzheimer's disease, and clearly diabetes. So this is what we want to prevent. And so looking at some of these things, we can think, all right, what do we need to do to get our waist circumference in a normal range? So oftentimes that's losing weight, and we'll be able to address these things. So, I think it is just a lot of it is a function of stress, sleep, activity, and nutrition for sure. So there's a variety of different tools for monitoring and tracking. And people, I think, are very familiar with the concept of a blood sugar monitor. And the standard that we've always had is the little finger stick thing where you prick your finger and slide it into the little machine and you get a number. So those anybody can buy anywhere, and you can always check your blood sugar. And I think it's actually a pretty neat learning experience to do that. What is kind of on the horizon, and we're seeing more over these continuous glucose monitors, and a couple of them, there's really probably four. I think there might be more. There's a Freestyle Libre, the Dexcom, Medtronic has one. I think it's called GlucoSense, and Senseonics all have continuous blood glucose monitors. And these are by prescription only. There are some non-prescription options that you can find on the web by January AI, Levels, NutriSense. And so there are other options. Interestingly, what we're learning is if we have specific diagnostic codes, so if you have a high blood sugar on one time, we can often say like, oh, you have hyperglycemia, which means high blood sugar. And a lot of times we can even get these covered from a prescription standpoint. Fitbit, Apple, and Google are all looking at and investing in this continuous glucose monitor technology. And I think as time goes on, this will become more widely available. Many of you know that I have worn one on and off for almost 2 years now, and I find it super fascinating. It's a great learning tool. I definitely know some things that I can eat and keep my blood sugar in a really healthy, normal range. And I am completely aware of what will really push my blood sugar high. So fun. Anybody can go get the finger stick one. You can get that on Amazon or at the grocery store, really. But the continuous glucose monitors, I think eventually will be kind of where more people will head. And it's just fascinating that at one point years ago, you didn't need a prescription for any of these sort of diabetic things. And now it's interesting to me that we want to limit who gets to use them. But what I think it highlights is that we're really a disease-focused care system. I don't even want to call it healthcare really, but versus a wellness oriented system so that we could prevent things. So getting into things that we can do, nutrition for a healthy blood sugar, keys to focus on limiting carbohydrates. The American Diabetes Association and a lot of nutrition folks are still teaching diabetics how to count carbohydrates. There's definitely some relevance when you're dealing with somebody who is a type 1 diabetic. But for somebody who has non-insulin dependent diabetes, really limiting the number of carbohydrates is going to reduce whether you have elevated, it'll reduce that elevated insulin, which is really what we want. We need quality proteins and fats, and really learning our unique needs takes time and tracking. The other caveat that I would throw in here is we talked a little bit about microbiome, and we now know that our microbiome plays a huge role in determining our glycemic response to different foods. And as an example of this, there's a company called Day 2. You can send them a stool sample, and they basically do what we call a shotgun assay on it, and they can tell you what your microbiome is made of. And it's pretty cool. Like, what are all the bacteria, virus, fungi, all of those different things. Well, they have then taken it a step further, and based on your specific microbiome, you can actually predict what your blood sugar response would be to a variety of different foods. And their app is expanding in the time since I have done it, and it's pretty fascinating. And that's what really drove me to get the continuous glucose monitor that I wear, is just to be able to go, wow, you know what, if I just eat an apple, it will shoot my blood sugar up. if I eat an apple and say some walnuts and a little bit of cheese, now I won't get that blood sugar response. So it's really fascinating when you start looking at those things. And really, I think as we go in the future, really will provide us a lot more options, because I think it's really individualized learning when we get to do that. So a really great starting point from a nutrition standpoint is something called a cardiometabolic food plan. This is something that was created through the Institute for Functional Medicine. It really is focused on a Mediterranean diet. And then, and I'll show you an example of that. And the other thing to think about is using, there's a variety of different apps for your phone, but one that I really like to use, and I've talked to a lot of people about, is the Dirty Dozen app. And it's a free app, but it will give you the top 12, like kind of most pesticide or toxin laden fruits and vegetables. And then it has, so there's the Dirty Dozen, the Clean 15, and then you can see this full list of, I want to say it's about 50 now. So you can kind of get an idea, like avocados, you don't need to buy those organic. Like they just don't have high pesticides. But when you're thinking about apples, strawberries, a variety of different leafy greens, those things are really important to buy organic. And this gets into where those toxins can mess with your metabolic machinery and increase your risk of diabetes and prediabetes. So the Dirty Dozen app is actually pretty cool to use. You'll save some money in some places where you thought, if you're trying to buy all organic, like there's just some things you don't really need to sweat it, and other things you should really pay attention to. And this is kind of what the cardiometabolic food plan looks like. And we can set this up. I basically can help somebody figure out what their basal metabolic rate is. So how many calories do you need and how many calories do you burn in a day? And so we can set it up so that I could say, oh, you need 7 to 8 servings of protein in a day, and maybe 1 to 2 servings of legumes and 1 to 2 servings of dairy. So we can go through this, and it's kind of neat to go through this. I've got also a guide that talks about recipes with this, as well as meal planning ideas, snack ideas. So this is really a neat thing to be able to use. It isn't telling you to eat or not to eat something. It's really trying to just help go, well, have I eaten enough protein today, or different things like that. So in that way, it's fun, and it lends itself to creativity, and then we're also not asking you to completely change your diet, hopefully. In terms of meal timing and fasting, we can think about this in a couple of ways as well. Probably a lot of people have heard of intermittent fasting, and basically what that comes down to is eating in some sort of a time restricted window. So thinking about, it's probably a good idea to be able to fast for 12 hours overnight. But not everybody can do that. I would say as an initial goal, that would be a good goal to start to improve your metabolic flexibility, so that what we want our body to be able to do is, rather than solely needing carbohydrates to survive, we want our body to be able to start to dip in and kind of burn fat stores. And so working on this intermittent fasting can actually help that. Not everybody can tolerate it, but it is a worthwhile thing. It's free, and anybody has access to it. One thing to think about is timing. It's definitely probably better to eat earlier in the day than later at night. Clearly that's going to make a difference if you're a night shift worker or those kind of things. But I would prefer, if somebody's going to have, say, an 8-hour fasting or an 8-hour eating window, noon to 8. I guess it depends when you go to bed, because eating late at night and going to bed, like we just know through studies, has shown more weight gain over time. The other options are just fasting. And there's a fair bit of research supporting prolonged fasting to reduce diabetes risk. People, you may have heard of Dr. Jason Fung. He has written about fasting, about obesity, all of those things. And so there's books available. And there's commercial kits such as Prolon, which we carry here, and that's a 5-day fast mimicking diet. So it's pretty interesting because you actually are eating these prescribed things each day, but your body actually thinks you're doing a 5-day fast. So it's pretty fascinating. Generally, it's tolerated pretty well. I've done these a number of times. I think that you're mostly having soup and some bars, and like it's okay, like not it's not a bad thing. I actually kind of like some of the soup. So there's more advantages in terms of immune system support and that kind of stuff with a kit such as Prolon. Talking about movement, I think we've spent a lot of time talking about movement and blood sugar control. So one of the things that actually will interfere with our ability to uptake glucose into our muscles is if we get fat in our muscles, and that can really impair that glucose uptake. So really important, thinking about it, and it depends where you are in terms of activity. If you're just starting, just think about 30 minutes a day, 5 days a week of movement, any movement. You can break it down into 10-minute sessions, however you need to. If you are really kind of beyond like, yeah, I do 30 minutes a day all the time, well, you can certainly add in more increased intensity there then. So you don't necessarily have to get as many minutes in a week, but you would increase that intensity. There's a bit of debate, I think, ongoing as to, are you better to stay in a lower heart rate zone for a longer period of time versus that increased intensity. And I think there's advantage to either one. And the biggest thing is movement. Resistance training can make a big difference because you're going to improve your strength. And so things that we've talked about before, like the key 3 exercises, a squat, a chest press, and a single arm row, that's really simple to do and is not super time consuming. Some stretching, a couple times a week, and then doing things that require balance, agility, and coordination. And that can just tie in with walking, or certainly if you're doing resistance training. If you're on machines, you're not doing so much in terms of having to have balance and coordination, but if you're doing more free weight kind of things, that is already incorporated as well. So all of these things we know will help. It will decrease your diabetes risk, your heart disease risk. And, when it's nice out, it's not such a bad thing too. In terms of sleep, so poor sleep increases insulin resistance, poor sleep increases hunger, and both of these increase, or contribute weight gain and will increase our diabetes risk. So a few simple strategies to think about if you're struggling: regular bed timing, so regular time to sleep, regular wake times, limiting blue light, and make sure that you really keep your sleep area dark, cool, quiet, those kind of things. Avoiding caffeine before bed, and certainly if somebody drinks a lot of caffeine and is having trouble sleeping, that would be one of the first things I would say to cut back on is caffeine. So just thinking about those things, if you snore or have breathing difficulty during the night, getting a sleep study would be really important as well, because we know that if that is corrected, it really reduces your risk as well. And stress. So chronic stress negatively impacts our health, which I think most people clearly understand. And over time, stress is going to cause weight gain, and it really causes us to gain that weight in the midsection again. And that's where we get what we call visceral adipose tissue, and it's very inflammatory to walk around with. It's kind of more like if you're carrying weight in a midsection, that is definitely an increased risk for diabetes and cardiac disease. Think about also if you're, if you're under stress, and we think about fight or flight. So you have a sympathetic state. What's happening is like your body is trying to make sure that glucose is available. Your insulin levels fall, your liver starts producing glucose. And when we have all this adrenaline and cortisol running around, our tissues are less insulin sensitive. So you can see, like, if you're chronically under stress, it makes it really, really hard, as people know, to lose weight, but it also makes it really hard to drop your blood sugar. I can see if I have a couple of nights where I sleep more poorly for whatever reason, I can see it in my blood sugar on my continuous blood glucose monitor the following day. And for anybody who has ever worked nights or had to stay up all night, think about, like, what are you drawn to eating? For me, if I wasn't sleeping in residency, like my worst craving was Cheetos. Like, so if you saw me up in the middle of the night, I was probably eating Cheetos, which is like, thank goodness I'm well past residency, but it's a really real thing. And I think when people are really tired, you think people reach toward carbs and sugar and those kind of things. So anything we can do to manage and reduce stress is really a great idea and beneficial to our health. So whether, movement obviously can help with stress, just go outside, walk outside, meditation, prayer, journaling, yoga. You could do Tai Chi or Qigong, like lots of different things, or just being able to spend time with people that you love and laugh and share a meal. Those things will all make a huge difference in reducing stress. And then kind of one of the last, we're kind of getting down here, but a couple things I wanted to show you because I think it's so cool, is that when I first learned this, I was like, whoa, look at that. So when we look at what happens when you have an elevated blood sugar, we have all of these things are different medications that we can use to, for the small intestine to digest polysaccharides. This is acarbose we can use. And so in the liver, how do we decrease glucose production? In the pancreas, how do we improve our insulin secretion? How do we decrease fatty acids? How do we increase glucose uptake? And so there's medications, obviously, that we can use at every step. But like, we can also decrease digestion of polysaccharides. Like, how can we do that? Well, low glycemic impact foods, so non-sugar, high fiber, that can make a difference. To increase our skeletal muscle uptake, things like vitamin D, omega-3 fatty acids, alpha lipoic acid, chromium and vanadium. These are often in a multivitamin. Magnesium is a huge thing. Vitamin C, antioxidants, vitamin C, vitamin E, impaired insulin secretion, vitamin D. So it's really cool because you can see how in most places, we certainly have like focused on medications and these mechanisms, but there are things we can do with food and supplements as well. And that to me is really cool because more often than not, there's less adverse effect when we're utilizing those things. And this kind of gives a review of like, what are some of these potentially helpful supplements? Chromium, vitamin D, making sure our vitamin D level is adequate. These are things we've talked about for immune support as well. Magnesium can be helpful. CoQ10, alpha lipoic acid can be helpful, especially if people have numbness in their feet. EPA, DHA is basically fish oil. So for us, if you're a fish eater, salmon can be really helpful. Vanadium, that is mineral and would be in a multivitamin. Biotin is one of our B vitamins. and the antioxidants, so vitamin C, zinc, selenium. So lots of neat things here, and there are specific formulations that different supplement companies have made that actually have some of these in here in combinations, which is pretty neat as well. So in summary, hopefully you have a better understanding of glucose and insulin, how to define diabetes, prediabetes, and insulin resistance, and then review nutrition approaches and movement. We've gone over a little bit of sleep and stress, as well as meds and supplements. And there's a handful of references that are here. And at this point, I want to open it up if anybody's got any questions or comments.